This morning in a Metro Atlanta hospital room, a mother lies brain dead. Her family left reeling. Machines are keeping her body functioning only because she is pregnant. Her case is now raising new questions about Georgia's heartbeat law. Adriana Smith's family says they're being forced to wait without a voice while doctors try to keep her body functioning long enough to deliver her baby. Adriana has been on a ventilator for more than 90 days, and her family says they have no control over what happens next. 11 Alive's Cody Alcorn shares their story.
30-year-old Adriana Smith was about 9 weeks pregnant when she started having bad headaches in February.
Enough to know that something was wrong.
April Newkirk says her daughter went to Northside Hospital for help.
They gave her some medication, but they didn't do any tests. They didn't do any CT scans. If they did, they would have caught it.
The next morning, Adriana's boyfriend noticed something was terribly wrong.
She was gasping for air in her sleep, gargling. More than likely it was blood. She was taken to Emory, Decatur, and then she was transferred here.
To Emory University Hospital, where Adriana worked as an RN. Unfortunately, there was nothing doctors could do.
They did a CT scan and she had blood clots all in her head. So they had asked me if they could do a procedure to relieve them, and I said yes. And then they called me back and they said that they couldn't do it.
Doctors declared Adriana brain dead.
I feel as if somebody dropped the ball at the hospitals, and her boyfriend asked, please keep her. If she was kept at the hospital, we wouldn't be here.
Because of Georgia's heartbeat bill, which bans abortions after a fetal heartbeat is detected, her family says they weren't given any say in what happens next.
It's torture for me. I come here and I see my daughter breathing by the ventilator, but she's not there. And I'm touching her. And she has a son who I bring to see her.
Now, 21 weeks pregnant, her baby's health uncertain.
She's pregnant with my grandson, but my grandson may be blind, may not be able to walk, wheelchair bound. We don't know if he'll live once she has him.
A situation she says no one should be forced into.
It should have been left up to the family because I'm in my 50s, her dad is in his 50s, so we're gonna have the responsibility with her partner to raise her sons, you know? And I'm not saying that we would have chose to terminate her pregnancy. What I'm saying is we should have had a choice. We should have had a choice.
Cody Alcorn, 11 Alive News.
It is likely doctors will not induce Adriana for at least another month. Right now, under Georgia law, once a fetal heartbeat is detected around 6 weeks of pregnancy, abortion is illegal. Now, Georgia's Life Act says that, quote, no abortion is authorized or shall be performed if an unborn child has been determined to have a detectable human heartbeat. And again, Adriana was 9 weeks pregnant, at the time she suffered from the brain clots. And because she's brain dead and no longer technically at risk herself, the law requires doctors to keep her alive until the baby can survive on its own. Because this is what the law says when it comes to the pregnant woman having a medical emergency. It says, quote, medical emergency means a condition in which an abortion is necessary in order to prevent the death of the pregnant woman or the substantial and irreversible physical impairment of a major bodily function of the pregnant woman. When we reached out to Emory Healthcare, it told us they do not comment on individual patients, but they did tell us in a statement that Emory Healthcare uses consensus from clinical experts, medical literature, and legal guidance to support our providers as they make individualized treatment recommendations in compliance with Georgia's abortion laws and other applicable laws. Earlier this week, we talked with Monica Simpson, the executive director of Sister Song. That's a group that advocates for reproductive rights. She says what the Smith family is going through highlights the barriers built by the law.
And so now we are seeing a combination of factors here in this story that is making it so difficult for this family not only to navigate, but to also be able to get to a place where they could actually get to the healing that they deserve.
And then on Friday, we talked with Republican Georgia State Senator Ed Seltzer, who introduced the state's heartbeat law back in 2019.
Doug, I'm thankful that the hospital recognized the full value of the small human life that's living inside of this tragically dying young mother. Mindful of the agony of this young mother's family.
We also asked Georgia Attorney General Chris Carr, who's running for governor next year, about the case. His office says their prayers go out to Smith's family, also saying there is nothing in the Life Act that requires medical professionals to keep a woman on life support after brain death. Removing life support is not an action with the purpose to terminate a pregnancy, he said. 11 Alive was first to share the Smith family story. You can find our extended coverage right now on 11alive.com.